are here for a short discussion and interview session with both of them on the topic of skincare and skin routine. Before we begin, could you please introduce yourself?
Thank you so much for having us. My name is Sarai and I'm a fourth year bachelor student at the University of Utrecht studying skin and edema therapy.
And my name is Rosa. I'm also a fourth year student at the same study as Sarai, so we're colleagues actually.
So for your first question, what scope of skincare do you see at Nepal?
We're seeing a lot of things that people find it important to have fair skin. So I think people see tan here as more of a negative thing, whilst in the Netherlands people love to be tan, and we try to be in the sun always, and we see it as a beauty standard, while here it's kind of the opposite.
What kind of career prospects in dermatology can be available for them here in Nepal or anywhere in the world?
Well, the cosmetic career is very upcoming. People are really doing their own research in like what is possible. They're looking at more advanced treatments. Also the medical field, there will always be career possibilities in the medical field as well.
What is the most difficult or challenging case you as individuals have dealt with?
I think actually what we've been treating here in Merel at the medical center is very challenging for us because we have seen a lot of scars. People are suffering from these scars for like 3 years, so they're very hard to treat. And also there are not as many medical supplies as we have in the Netherlands, so it's been challenging for us to really give the people the best care they need, but that was also really like a very interesting thing to do.
So in the Netherlands we can really talk to the patients about the influence, but here because we have the language barrier, a lot of times we cannot really ask like what is it that is really keeping them down. A lot of times people will get depression, like a lot of psychological things after they have like very big burn wounds. You can only imagine how difficult it is if half your body is covered in scars. It really impacts you. So we really try to look at that as well and really give the patient a very comfortable experience.
Moving on with another question. In context of Nepal, what situation and awareness of dermatology do you see? As you said that something that's been difficult for both of you is the emotional level of sharing you both cannot do because of the language barrier. So what kind of awareness or situation of dermatology do you see here at Nepal, especially of Miro?
In a lot of cases I would say there is a lack of awareness. People are sometimes given the wrong advice from hospitals as well because it's easier and it is more cost effective, so it's cheaper, even though that will not help them at all. So we've seen some cases where people have maybe been given the wrong advice that could actually worsen their condition just because maybe for the sake of financial problems.
Moving on, according to both of you, which area of the body should one pay more attention to or provide skin therapy to? The face, the hand, the chest, the back, which area?
I think the face is the most important thing to apply skincare on because it's very important to treat the face with especially sunscreen or at least the areas that are sun exposed the most, because that are also the areas where skin cancer can grow eventually. So it's really important to focus on that skin parts, I think, for preventing skin cancer.
Yeah, and the skin on the face is also very different than the skin on the rest of your body. So it really needs the most care, and it's also the most difficult to take care of. As your body, you can just put a regular body lotion, but on your skin you need to really think about what you're doing, and it's the first things people see, so it's quite important to take good care of your skin, we think.
I think the last question is a question I want to hear an answer to. Is any suggestion or tip you would like to provide to the students and the ones who are going to be watching the video about skin therapy and skincare?
Yeah, I think it's important to know which skin type you have. So really think about, for example, does your skin feel tight after a shower? That probably means that you have more dry skin. Based on the skin type, you can look for good products, like we showed in the presentation. You can buy CeraVe here or Himalayan, those kind of products are very good to use. So really use a cleanser. And if you have more sensitive skin, you can cleanse like 1 time per day. And if you have more oily skin, you can cleanse 2 times a day, followed by a good moisturizer and of course a sunscreen. I think that are the most important steps. And if you have really a specific skin problem like acne or pigmentation on your skin, then you can add additional products like a serum or something.
Yeah, it's also very important to stay consistent. So a lot of times people will, want to change their products because they think, oh, this isn't working. Try to stick with something for at least a month, preferably 3 months, to really see if it's working. And sometimes less is more. So have some good quality products and use those, and don't use like all the crazy masks, like the peel-off mask trends you see. Like those a lot of times do more harm than good. So be very gentle with your skin, and also don't be too critical. Like, you're young, your skin is not always going to be perfect, and that's totally fine. Just be grateful that it's working and that it's doing its job. So I think be more kind to yourself. That can also very much work.
So everyone, with this we come to an end of this amazing interview. It was so heart-touching to hear their experiences here at Nepal with Mero, and I think I also connected to them a lot at a personal level because I got tips with my skin as well, which I think is something I really needed. So thank you to both of you.
Yes, thank you.
Thank you so much.